Dear viewers, I'm Dr. Adil Riaz, consultant radiologist at Ilyas Medicare and Diagnostic Center, and today we are here with another episode of our ultrasound training course. Before I tell you about this episode, I want to apologize for a little mistake which happened in ultrasound training course episode 12 of our abdominal series, in which, due to some mistake, I was unable to share my ultrasound screen with you people. I have updated that video, and I hope that now you will like that video. You can watch it again. Sorry for the inconvenience. And now coming to this episode. This is the second episode of our pelvic ultrasound series, and in this episode I'm going to discuss that how the uterus and ovaries appear on the ultrasound, normal uterus and ovaries, how they will appear, and I will show you how different layers of the uterus will appear, and I will explain in details on the sonographic images. So in the coming episodes, I will be discussing the probe maneuvering, tips and tricks about the pelvic ultrasound. I hope you will like this episode and the coming episodes also. In my previous episode, I didn't share any ultrasound images. That was because of the fact that we must know about some of the basic anatomy. It was necessary. In all the coming episode, we are going with our ultrasound images. So let's start. Coming to the first image. The first image is, so this is the diagram showing the cross section of the pelvis. Here you can see this is the point where we have to place our probe. This is marked by arrow, and this point is just above the pelvic bone. This is the pelvic bone. We have to place our probe just above the pelvic bone to visualize the pelvic structures. Here is the bladder, and in this diagram I have shown a half-filled bladder, so that I could signify that this part of the uterus which is behind the bladder will be visible to us, but that this part of the uterus which is above the bladder will not be visible to us, because it will be obscured by bowel gases. So ideally the bladder should be filled full to completely visualize the uterus, otherwise the fundal region of the uterus will not be visible to us. This is the cul-de-sac behind the uterus, and in between the uterus and the rectum, this is the rectum. Here is the sacral bone lying behind the rectum. So now we will move toward the ultrasound image and see that how. So here is the longitudinal image of the pelvis. This is the point from where the sound waves are entering in the body. These are the abdominal wall musculature, and behind this is this black colored structure is the urinary bladder. We know that it is that fluid appears black on the ultrasound, and this is the urine within the bladder which is appearing black. Behind this is the uterus. This part of the uterus, which is the outer lining and is serosa. This inner relatively hypoechoic, the grayish in appearance, is the myometrium, and within the myometrium this hyperechoic straight line is the endometrium. Now coming to different parts of the uterus. This upper part is the fundus of the uterus. This is the body of the uterus, and below the body is the cervix. This area is the cervix of the uterus, and going further we can see this area is the area of the vaginal stripe. With this we came to an end of this image. Now moving toward the next image. Here is another image. This is also the longitudinal image of the uterus. In this image, I am sharing this image just to show you the fact that how with the different body build of the different patients the image appearance changes. This is the urinary bladder, and behind the urinary bladder here is the uterus. You can see that the outline of this uterus is not that much clear as it was in the previous image, and this is only because of the appearance of body build of the patient. Now coming to the next image. Here in this image we can see a transverse section of the uterus and right ovary. Here is another transverse section, and in this section you can see that uterus is more clearly outlined. This is because this patient is a little bit thin, lean than that of the previous patient. Now coming to the next image. This is the image of the left ovary, which I have shown in the longitudinal plane. This is urinary bladder, and behind the urinary bladder, this is the left ovary. I have tilted my probe a little bit toward the left side to show you this. This is a magnified image of the ovary. In this you can see that different follicles, a number of follicles are arranged at the periphery with the central stroma. I hope you liked all the images and I was able to explain them accurately to you. With this, we came to an end of this episode. In the coming episode, I'm going to explain the probe maneuvering and the tips and tricks that are how to visualize, how to focus the uterus and the ovaries in the pelvic scans. I hope that you will like, share, comment, subscribe to my channel. Your feedback is very important, as I have already mentioned that one of my mistakes was pointed out by one of my viewers, and I'm thankful to him for this. Thank you so much. Allah Hafiz.